Live, late breaking, WESH 2 News Sunrise.
You hear it all the time. Parenthood is a priceless experience. But what some moms and dads are learning is that the process of becoming a parent can come with a huge cost.
Infertility has become a mainstream health issue, one that means if you don't have money, you may not be able to have a baby. Meredith McDonough explains why in Florida the situation is especially difficult.
Which is heart-wrenching because, you know, we tried for a year to get pregnant and nothing was happening, and suddenly something changed in my body and my body decided, like, let's do this, but then something was fighting it.
Savon and Craig Ratu of Ocoee spent 4 years trying to have a baby. After countless doctor's appointments, injections, and 3 miscarriages, they remained childless.
On Christmas Day, celebrating the holidays with everybody, lost it again. And so just rinse and repeat, like over and over 3 times, and all of a sudden now couldn't get pregnant at all.
And they are not alone. According to the CDC, 1 in 8 couples have trouble getting pregnant. After those 3 heartbreaking losses, Savon and Craig's dream of becoming parents was fading.
There were times when I said, like, I understand if you don't want to be with me because I can't give you a baby.
Together, they decided to try in vitro fertilization, combining their eggs and sperm in a laboratory. But the decision was a heavy one because the procedure plus medication would cost them $30,000.
Don't really know until the numbers are right in front of you and you're handing over your credit card, not your insurance card.
So she lies on that table.
Fertility specialist Dr. Mark Trolice at Fertility CARE, the IVF Center in Winter Park, is their doctor. He's frustrated with how the high price of parenthood creates a divide.
It's almost causing a significant unbalance and favoring patients who have a higher socioeconomic status or are wealthier. And that's unfair.
Trolice's frustration is compounded by knowing the price burden could be lessened. 15 states have passed laws that require insurers to cover or offer coverage for infertility diagnosis and treatment. Florida is not one of them.
Well, infertility affects 12% of the population. It's clearly a prevalent disease and one that should be covered by insurance.
We just wanted to be parents so bad, and to see Landon in particular.
You got this.
It's just a great experience so far.
After 4 long years and significant emotional and financial strain came the amazing news Savon was pregnant. The baby announcement from the lab and IVF needles spelling out, "We are pregnant."
They have years.
Dr. Trolice says couples who are struggling with fertility should go for specific testing immediately.
We need to determine if she's ovulating. We need to determine if her fallopian tubes are open. And we need to know that if the male partner, if the sperm analysis is normal.
Dr. Trolice says these tests can pinpoint issues and cut out unnecessary procedures and costs, saving time and money better spent on taking a new baby home like little Landon.
The financial aspect, obviously that's not ideal. The fact that nothing is covered by insurance, that's a huge blow to the whole experience. But, you know, to have that outcome,
Priceless.
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 Yeah.
For anyone struggling to conceive, Dr. Trolice stresses seeing a specialist as soon as possible. He says it could save time and money for those longing to be parents. Meredith McDonough, WESH 2 News.
And the Florida Office of Insurance Regulation told WESH 2 News that the state views fertility treatments as an elective procedure, and that is why insurance does not have to cover it.